So basically what you have is called hyperopia.
Oh yeah, oh yeah.
Yeah,
I went
hyperopia.
over that in med school, the hyperopia. That's the third day of med school.
You remember that, yeah. And then the presbyopia, that's on the fourth day. So that's the reading problem that we all run into in our 40s, right? So, and beyond. But the good thing is the scans that we did of the topography, in other words, the curvature of the cornea, the shape that the cornea has, is amenable to changing that shape with the laser. Basically, that's Lasik. So Lasik, what it does, changes the shape of the cornea, and that helps the light focus in the back of the eye, so you don't have to put anything in front. Farsighted or hyperopia eyes focus way back here. You got to bring that light to the back. The opposite is myopia or nearsighted. They focus in too soon, so it's still blurry. So if you focus in front or behind this yellow tissue, this retina back here, it's going to be blurry. So you got to do something to help. In your case, your distance is pretty good. You have a little bit of hyperopia, which is correctable with the Lasik. Then we run into the presbyopia problem, which is what we all get with the reading, and that's because this lens inside the eye has aged. Pretty typical between 40 and 50. It doesn't flex as much as it used to, and so we have to keep pushing things out or pop on those magnifiers. Yep. So the way around that with Lasik is changing the shape of the cornea, but giving it the power it needs to focus up close. And then, of course, the other eye would be the hyperopic correction for the distance.
So you'd correct both eyes?
You'd correct both in a format we call monovision, where you got one eye for far and one eye for reading. Basically, that reading power is now on one side and your distance power is on the other. Okay, so Sean, the treatment, Lasik treatment is done in about 10 minutes. That's for both eyes, so it's pretty quick. Using topical anesthetic.
And no pain involved? Or?
No pain. The numbing drops, topical drops is all we need. Numbs the surface. You don't feel anything sharp or painful. There's a sensation of pressure and temperature. Because this laser suites are a little bit cooler, when we lubricate the eye, some people still sense that temperature. It's like, feels like a cold drop. It's obviously not painful. Pressure, not pain, but for pressure, it's probably about a 20-second feeling of tightness on the eye. That allows the laser to do its job without the eye rotating and moving around.
Well, what are the risks?
Yeah, the risks, thankfully, are very minimal. Serious risks, scars, infections, things that can make your vision worse instead of better. In fact, it's so unusual. I had my Lasik done about 18 years ago now.
Are we talking about tonsils coming out or like 2 stitches? what degree of what degree of risk?
Oh, really, you have more risk from wearing contact lenses than with Lasik. Side effects, people talk about dryness, halos, very common in the beginning, but long-term pretty unusual, very unusual. And of course, there's treatments for those types of things, yeah. One of the other things with monovision is just getting your brain to adapt. For X number of years, both eyes are distance or both eyes reading, and in 10 minutes we switch it on your brain. So there's some adaptation period, and that's why we're going to do those contact lens fittings just to see what you think.
Very good.